You are glowing. It's a phrase women hear a lot during pregnancy when it comes to their skin. But when was the last time you questioned what's actually happening beneath the surface and what comes after? Because for many women, skin doesn't just glow, it changes dramatically. From acne and pigmentation during pregnancy to dryness and sensitivity postpartum, these changes are incredibly common. And yet, when these changes come about, it can feel shocking and worrying. You start questioning what's hormonal, what's normal, what will settle, and what needs support. During pregnancy, I remember noticing changes in my skin almost immediately. As someone who has struggled with acne a lot over the years and been on both topical and oral treatments, I noticed my skin surprisingly improved during pregnancy, and then took a turn once I stopped breastfeeding. During the whole experience, I wasn't sure what was safe to use, what I should be using, and what to avoid altogether. And it's continued to shift. Dryness, breakouts, dullness, and it's all coming at a time when I feel least equipped to deal with it. I'm Katie O'Malley, journalist, broadcaster, and founder of A Long Way to Go. And today I'll be finding out all about what actually happens to our skin during pregnancy and postpartum, and how we can support it in a way that's safe, informed, and realistic. To do this, I'm so excited to be joined by the incredible Dr Ifeoma Ejikeme. Dr Ejikeme is a consultant physician and skin specialist, as well as the founder of Skin and medical director of Adonia Medical Clinic. At present, she boasts almost 94,000 followers on Instagram, where she answers all the skincare questions you wish you'd have the expert answers to, from the serums to be using and what to do with hyperpigmentation, to collagen drinks and eye creams. She was also a senior lecturer at Queen Mary University, where she trained plastic surgeons, dermatologists, doctors and dentists from around the world on safe and effective aesthetic procedures. She has worked with over 30,000 patients, and she is one of the leading experts when it comes to skin in the UK, and I'm so honoured to have her join me on the podcast. So Dr Ejikeme, welcome to A Long Way to Go.
Oh, thank you. It's lovely to be here.
Thank you. So to start off, I think there's a lot of confusion around skin during pregnancy itself, and you hear about the pregnancy glow. But for many women, the experience is much more complex. So what's actually happening hormonally during pregnancy that affects our skin?
So the skin is complex, isn't it? Even outside pregnancy, just changes in your menstrual cycle, you see huge changes and shifts in your skin. And this is largely driven by estrogen, progesterone, testosterone. And, round about the LH surge in the midpoint of your cycle, you'll notice skin looks glowy and lovely. And then it dips. And right before menstruation, your skin changes. It gets dry again. Now, during a pregnancy state, you're kind of pushed into that high hormone state round about that midpoint of your cycle. So you look glowy, you look dewy. But for some people, during pregnancy, you're also dehydrated, you're also vomiting, you're also struggling with your breath. There's so much going on, so you can then get superficial dehydration. You can get a situation where your skin is dry, or really oily. You can be irritable, your skin can be irritated, or your skin can be lovely, bouncy, and glowy. And you never quite know who you'll be until pregnancy. And the interesting thing is, from one pregnancy to the next, your skin can be completely different.
And what are the most common skin conditions that actually do occur during pregnancy? Why do they occur? Either pigmentation, acne?
So the most common is pigmentation. This kind of happens during pregnancy. You might remember that as your tummy swells, you get that either red or brown line, the linea alba in the tummy, and you tend to have more of a pigment-rich skin. So that also means, on the other hand, you are more prone to pigmentation, whether that's patchy pigmentation or a condition in pregnancy known as chloasma. Outside pregnancy, it's known as melasma, which is this symmetrically asymmetric patch of pigment on the cheeks, upper lip and the nose, and sometimes on the forehead. And in some people, it goes away afterwards, and in some people, it persists. But this is one of the things that I really see a lot of people complain about during pregnancy. The other is breakouts. With all that lovely, dewy increase in oils in the skin, if your skin is naturally quite oily, you may be prone to breakouts and clogged pores. So breakouts do happen in pregnancy as well. The third thing that I see very commonly is just dry skin. Irritable, dry skin, and just feeling like you can't get enough moisture into the skin. And usually this is a function of just hydration. If you're vomiting through the first trimester, second or even third trimester, you just can't keep enough in, and that just leads to dehydrated skin.
think there's so many things as well that you just forget can factor into these things when it comes to skin.
Completely.
It's crazy. And during pregnancy, I know a lot of people have concerns about what products they should be using, what chemicals they should be using. So just here and now, what are the things we should be avoiding and what should we be using?
Yeah, I think there's a lot of fear mongering.
A lot of fear mongering. You're terrified. I think during my whole pregnancy, I was like, if I put a moisturizer on, that's a lot.
Yes, yeah. So it's important to know you can cleanse, you can wash your skin, you can use serums, you can moisturize your skin, you can use antioxidants, which are things like vitamin C, and you can protect your skin with sunscreen. All of these are safe. The things that you shouldn't use in pregnancy is salicylic acid over 2%. So if it's under 2%, it's actually okay, but over 2%, and there are a lot of very popular brands that are over 2%. So just have a look at the back, make sure that it's over 2%, put it away. And the second are retinoids.
Yes. Retinoids, I think, is everyone's so scared, rightly so.
Yeah, rightly so.
And I think that's really good to hear about what you should actually avoid during pregnancy, because there's so much confusion out there and there's so much discussion.
Yes, there's so much. I think some people wonder, should they stay off topical retinoids for a long time before they even get pregnant? That's not necessary. So we're talking about over-the-counter, not prescriptions. So an over-the-counter retinol or retinol, you can just, if you're pregnant, just avoid it during pregnancy. But interestingly, in breastfeeding, you can bring these back.
Oh, really?
Yes, and a lot of people don't know that.
I didn't know that.
That actually, after you've delivered, you can start your salicylic acid again and you can restart your retinoids. Now, some people choose not to because you put retinoids on your skin, you have little baby right on your face, and obviously baby can't have retinoids on their skin. So it depends how you use it, but theoretically you can actually use it during breastfeeding.
And what is the fear around retinoids during pregnancy and then postpartum? Because I think it's a lot of people are terrified of anything that they're consuming or putting on their face going to baby.
Yeah, so the theory comes from the oral Roaccutane or isotretinoin, which is a very, very powerful, it's kind of the strongest retinoid available, and it's used for the management of acne. And in that group, that absolutely cannot be used because it can cause definitive harm to the baby. And so whilst obviously topical retinoids are not isotretinoin, in order to be really safe, we say just avoid all retinoids.
Okay. And after you give birth, obviously the solid skincare routine that many people have spent years perfecting can often go out the window. And in reality, it goes along with women's health in general. You've got this new person to be looking after, and your health and skincare sometimes takes a backseat, which shouldn't, but naturally it can for a while. Yeah. So there are so many changes going on in the skin during the 4th trimester and beyond. So talk to me a bit about what happens hormonally after birth that impacts the skin that we should be aware of. Yeah.
So after birth, a lot of women decide to breastfeed. And when you're breastfeeding, you're in this state that's not quite pregnancy, but not quite your usual hormone. So you're still in a heightened hormonal state, still high estrogens, high progesterone levels. And that means that your skin tends to be a little bit more oily, a little bit more dewy, a little bit more plump. And in some people, that can be a little bit too oily, meaning breakouts. So that can happen. They're very similar to what you described in your experience, where you had spots beforehand and then it got better.
Which
surprisingly,
I always thought it would even get worse.
Yes.
I was so flummoxed. I was like, what is this? Why is this happening?
And I think that's really important because some people get really terrified that, if I've got breakouts beforehand, it's going to get so much worse. In many women, it just gets better. And that's the same with other skin conditions, like with eczema. Will suddenly get better during pregnancy, or the irritation will suddenly get better. And actually, that's a lot of women's experience, that their skin conditions kind of calm. Some people have flares during pregnancy, and then afterwards, things kind of calm down again. But in that period, kind of in the 4th trimester, there's a lot going on, not just with our skin, but also the hair. So if you think about what's just happened to the body, there's been a huge shift in terms of blood flow, in fluid levels, also in nutritional transfer, and the body needs time to replenish. And there are certain things that are almost universally low, like iron. And when iron is low, you are not going to see a boost, glowing skin, flowing hair. And that's when you see kind of dull, dehydrated skin, hair shedding and hair fall. And add to that what's actually happening. You are not sleeping, you are barely eating. There's a reason that Mama Bear's food was cold.
Yes.
And I think all mums now know your tea will be cold.
Your tea, your coffees, your dinner, everything is going to be cold.
And that means often you're not in a nutritionally excellent position, and that's going to show up sometimes in your skin and also in your hair. So I think it's important to know that it's temporary, that really tired, dry or sensitive skin that you've got in that period is temporary. And as things change, as you get more sleep, as you become more nutritionally repleted, as you start to do your skincare more, things actually improve pretty quickly.
I was going to say, actually, when it comes to duration, how long do these changes normally last for? And when should someone seek advice and they're thinking, okay, this has been going on quite a while now. Now I need some extra support?
Actually, at any point. Even in pregnancy, like if you find you're having significant acne in pregnancy and the acne is leaving scars, or you're really worried, there are things that can be done even in pregnancy. So it's important that if you're having changes to your skin that you think may cause significant scarring, you should seek medical advice. Go to your GP, have a chat with your GP straight away, because there are things that are safe in pregnancy.
There's also a huge amount of noise, I think, when it comes to, as we were touching on before, products to be using. And as a new mum, you're often trying to fix things quickly.
Yeah.
And sometimes you don't actually know what's appropriate, especially if you're breastfeeding or still recovering. And I know we touched on this previously, but what should a simple skincare routine that's really supportive look like during postpartum? When we think about if a woman has, realistically, 5 to 10 minutes, what does a skincare routine look like?
Okay, so before you can do your skincare routine, first you need to know what your skin type is. And there's a very, very simple test that you can do. Wash your face with a gentle cleanser and then just leave it for about 15 minutes. And that should be easy. Don't do anything. And see what happens to your skin. If your skin feels dry, like really leached moisture, really tight, you probably have dry skin. And if your skin actually feels pretty comfortable, or you notice that your skin's quite shiny, if you have visible pores or breakouts, you almost certainly have oily skin. Now, every skin type can be dehydrated, but it's important to know either you have dry skin or oily skin, and these are genetic set points. And that's really important because if that will drive the products that you need. Then you're going to use my 5-step skincare routine. That's
God, give it to us. Yeah.
So let's do the dry skin. For your dry skin, you need a cleanser. So wash your face with a gentle cleanser. Then you need some form of serum. Now, what I recommend is an antioxidant, a vitamin C. Keep it simple. The third step is a moisturizer. And if you have dry skin, it can be rich, it can be nourishing, anything that you can find that's really rich. And your fourth step in the morning is your sunscreen. That's it. Then at nighttime, it's going to be even easier. At nighttime, you're going to wash. If you have the strength, the wherewithal, you can add in an antioxidant serum or a hydrating serum. If not, skip that step. Wash, moisturizer. And that's really all you need through pregnancy.
I think it's so helpful to hear that, especially from an expert, because I think you see, especially on social media, so many of these 10-minute, 15-minute deep routines followed by red light therapy and all that. And it's realistically, when you're so time poor as a mum, you just need something that is going to be supportive, nourishing and realistic.
And safe.
Yeah.
Yeah, and I think that those 15-step skincare routines, even outside pregnancy, can just cause so much inflammation. And the thing about skin, it tends to be slightly more sensitive when you're pregnant, just slightly more sensitive. So doing a 15-step skincare routine will almost certainly, one of those ingredients will just be slightly too much. And then you end up with irritated skin, dry skin, scaly skin, to add to everything else that you have to do.
You don't need it.
You don't need that.
You don't need it. And when is it appropriate to consider treatments like facials, peels, or more advanced options, both during pregnancy and then also postpartum?
So during pregnancy, the only thing that would be safe would be kind of a pregnancy facial and a pregnancy massage. Why not? And with that, it's very, very simple products, no essential oils. And after pregnancy, you can actually have almost all your treatments. And again, lots of people don't know this. No. So people that do injectables, you can actually have all your injectables whilst breastfeeding. Now, most clinics will say wait till afterwards, but theoretically, by the book, you actually theoretically can. Now, during that immediate stage, there's a lot going on. In terms of your fluid shifts, you'll be dehydrated, your blood volumes may be lower, and at that point, wait at least 3 months. And then you can have many of your usual treatments, microneedling, PRP, facials, chemical peels, things like that.
And do you think most people avoid these treatments because there is a lot of fear-mongering and there's perhaps not clarity around these treatments and whether it's pregnancy safe or postpartum safe, or the ethics of testing, obviously, on pregnancy.
Yes, I think there have been no tests on pregnant women to know whether they're generally safe. So the general advice would be don't do them. And all reputable clinics would say do not treat pregnant women. The safety of yourself and the baby is most important. Now, afterwards, that's a clinic dependent. So some clinics just have a policy that they just don't treat anybody who's pregnant or breastfeeding and put them in the same category. Others will say, you know what, actually, on an individual basis, we can look at your medical history and what you're having. So that's really clinic dependent.
Okay. And what are the biggest mistakes you notice that women make when trying to fix or treat their skin postpartum? What's the most common thing that you see women doing postpartum that you're thinking, oh, maybe we could tweak that?
I think it's trying to do too much too soon. So the face and the body changes so much during pregnancy and immediately afterwards that changes continue naturally all by themselves for kind of 6 months afterwards. So for example, one of the treatments that we have in clinic is a body contouring treatment. And some people might think, you know what, I want to just get my stomach back straight away. But actually waiting 3 to 5 months, the body will change quite a lot. And that's important because if you do diet and exercise first, then your results will be better, you'll be physically stronger, and you will stop wasting money.
Yes.
Because you could pour lots of money into a treatment that's too soon, and it might bring you 1 or 2 weeks closer. But actually, if you'd waited that time, you'd have achieved that result by yourself. And that's the same for the face, for changes in the face. When people feel that their nose or their face, it does change due to fluid shifts. Most of that will come back by itself doing nothing. So often if I'll see a mum kind of 3 months post and she'll say, oh, my face feels really deflated, my lips feel really deflated, I've got these new dark circles. You know, we'll talk a lot about kind of what's happening. Are you sleeping? Are you drinking? Are you eating? When was the last time you had your multivitamins? Have you got vitamin D up to date? And all of those answers are usually, not sure.
Yeah.
Understandably, but so actually let's just wait a couple months and let's see you again in a couple of months. Couple of months, things have resolved by themselves. So I think it's just trying to do too much too soon, like giving the body time to actually help itself.
I think as well, when onto that point, it's when perhaps you've stopped breastfeeding and you're waiting perhaps for your period to return, or you're waiting for your hormones to come back in check. How long should you be waiting really until you think, okay, I've been waiting quite a while now, my period's returned, my period hasn't returned, my skin is I'm still unsure what it's doing. When should you really be thinking, okay, maybe I need to get a bit more support or advice here, or perhaps there's something I need to check?
So I review my patients at 6 weeks. If they've had a normal vaginal delivery, I review them at 6 weeks to see a check-in. And the 6 weeks is, how are you getting on with your skincare? What can we now bring in? What concerns do you have now? And how can we use skincare to tweak that? Because that's the best place to start. That 5th part of the skincare routine that I mentioned is customizing your routine. And at 6 weeks is when we start saying, okay, what's happened during the last year that you haven't had lots of treatments, or maybe you've pared down your skincare? What are your concerns at this point? Now, somebody may say redness, they may say dryness, pigmentation, or new fine lines. Then we would look at targeting one product for that thing. No treatments, just a product. And a conversation about kind of what are your goals now? What would you like to achieve over the next 3 months, 6 months, 12 months? And then schedule something in the calendar, maybe in 3 months' time, to come back and have another chat. So I think that's helpful because it gives you guidance of kind of, I know I have something in the diary that when I'm ready, there's something there to address these concerns if they haven't gone by themselves. So I think it's very individual. If it bothers you, that's the time to do it.
Yeah. And I think so many people are waiting, and you probably have this all the time in your clinic, wanting a quick fix. And they may use a product for a week and go, oh, it's not doing anything.
Not working.
Get rid of it. Wasted my money.
Yeah.
What would you say to people who are thinking, how long should I be using this product for until I see results? And also on that note as well, the one product really that we need to be thinking about postpartum is worth spending the money.
Okay. So consistency is the word. Like consistency. Nothing works in isolation. If you think about prescription products, which are the strongest, even they don't work in weeks. Certainly not days. It takes weeks and weeks and usually months to see an effect in the skin. So an over-the-counter products that you buy in your local shops is certainly not going to do that. So I often say 3 skin cycles, and each skin cycle is 6 weeks. So give it a good 18 weeks. Now, in that time, if you have irritation, burning, stinging, okay, put it in the bin. But if your skin is doing fine, you have to give it enough time to be able to see the results in the skin. So is there a holy grail product that that as a postpartum woman you should be using? But I think it's different for each woman, because for some women postpartum, it's pigmentation. And if pigmentation is your issue and you want something that's safe and effective, I'm going to tell you one. It does smell a little bit fishy, but the ingredient is called cysteamine. Yeah, so cysteamine is a really great ingredient. You can find it in different brands. And cysteamine, you can wear it as a mask. And lots of postpartum mums like it because sometimes you don't want something that stays on your skin for a long period of time. So you put it on and then you wash it off. So you can do the nighttime feed knowing there's nothing on your skin. So it's great. And you can put it all over your face. You put it universally over your face if you have any patches that have popped up. You can put it on the linear elbow if you want to try and clear that. You can put it on any patches that appear anywhere else. And you leave it on 15 minutes and you wash it off. A caveat, it does smell like fish, but
Okay.
It's wet.
At least you've warned everyone there.
But it's great. If your issue is dryness and dehydration, this is part and parcel of no sleep. Looking after a new baby, hyaluronic acid is your friend. Just douse your face in hyaluronic acid. Lots of hyaluronic acid. Don't have to spend time massaging it in. Throw it on in 5 seconds. Throw a moisturizer off it and just off you go.
Oh, that's so nice to hear that you don't have to be kind of massaging it in.
No.
And, ideally, if we all had time to do gua sha and massage,
tapping it in.
Tapping every bottle in.
Yeah.
But realistically, you want to pop it on your face and go.
And go. So pop it on your face and go. And then the third is sunscreen. So sunscreen is probably the single most helpful thing that you can do for your skin long term. And actually, it's the one thing that if you did nothing for 2 years, whilst you're pregnant until you decide to think about your skin and you have time, and you just did sunscreen, your skin is going to be in such a great position because you've done that one thing. So if there's one thing that you're like, you know what, I can't do that, just whack on the sunscreen, find one that you like. That's key. Because if it's chalky, greasy, sticky, you're not going to use it.
No.
And now there are 101 sunscreens, and the Korean sunscreens are great. So invest in one that you like. It doesn't get stuck anywhere. It's not white, chalky, and your skin, it feels breathable on your skin. And literally throw it on and get out the door.
As we know, skin isn't just physical. It's deeply tied to confidence and identity. And when it changes, it can feel incredibly unsettling, especially at a time when so much already feels in flux, different, new, and it's always constantly changing. So how can women manage expectations, especially when social media often shows a very curated version of postpartum? What would you say to them when it comes to managing expectations?
I would say take the bounce back and put it in the bin.
Yes. Love that message. We love that. A long way to go.
Put it in the bin, throw the bin away. With what I do, it is so deeply personal because it's very difficult to hide. And as nice as we would like people to be, people do make comments that can be really harsh. Oh, you look so tired. We're going to say everything okay. How's the little one? It must be so hard. All of these things just make you feel terrible. We all do the best that we can. You're a mum, I'm a mum. We all do the best that we can. And there are certain times where you don't want any comments on your appearance. You don't need any comments on your appearance because of your focus is on so many other things. It's on a baby, a toddler, on your house, on lots of other things, getting back into work. There's so many other things that take your attention in that minute. But people will often comment on your appearance, and that can be deeply painful. And I think the most important thing is if you have time and you have a want, and you do want to do something about it, that's the moment you should. You should, right. And you should feel nothing about it because that's the time that you should. And for some people, that's 6 weeks. And for some people, that's 3 years. And it's okay. But once you decide that you want to do, the most important thing is there are options. There are options for skincare. There are options for peels. There are options for the fat, the skin, the muscle, the bone, the pelvic floor, the hair. There are options for everything.
There are options. I think that's it. Sometimes you can feel so overwhelmed,
yes.
But also to know that there are options out there, there is support.
Yeah.
What would you say to someone who's feeling disconnected from how they look during pregnancy and after having a baby? Obviously, there's the managing expectations, but also what would you say to someone who just feels like this whole new body, but my skin, my hair, everything is so new to me. Yeah. And I feel disconnected.
Yeah, I would say that a lot, if not most women, feel that at some point during their pregnancy or the postpartum period, because so much has happened. You know, you were this person, you were this vision of this person before the world saw and spoke to you in a certain way. And then all of a sudden you become the pregnant lady with the golden egg, where everywhere you go, everyone looks and coos at you and says, oh my goodness, you're wonderful, you're beautiful, you're amazing. And lots of women don't feel that because your body has just massively changed. And then all of a sudden you deliver and you're no longer the golden egg. No. The baby is the golden egg and you're the lady that's standing next to the golden egg.
Yes. And literally overnight you go being from the golden egg to having the golden egg.
Yes. And it's like, oh, okay. And you have to rediscover this new identity for the third time. And that, as well as all the hormones as well, the hormonal shifts, you have to now also process how the world sees you as well as how you see yourself. And a lot of women yearn for their old self, for their old life, for the way they used to be viewed, as well as embracing who they are now. So I think this creates conflict within us. And I think it's okay to acknowledge that conflict, that it exists and it's okay that it exists. It's okay to say, I wish I was her. I love being this new person. I'd like to be another person that has a bit of her and a bit of this new person. And I think it's about refining the new you. And that takes time.
And that's okay.
That's okay.
And how can we manage a more long-term, sustainable, compassionate approach to skin health during postpartum? What would you say to someone who is thinking, obviously we've touched on having the quick fix, but I think we also need to be compassionate to ourselves. Like you've just said, it takes time.
It takes time. I've actually seen a shift that I think a few years ago there was this, I want to look tighter, sculpted, I want to look augmented, I want to be perfectly perfect. And I think there has been a real shift. And I see it a lot in I see it a lot in my patients who are postpartum, but also just generally that it's more about, I want to look rested, I want to feel refreshed, I don't want to have to wear makeup, I want to be able to leave my house and just, that's it, I'm done, throw some sunscreen and I'm done. I want a more natural version of myself, but I want to look like me, but less tired, not stressed.
Yes.
And I think that's a really lovely way to want to view yourself. Who doesn't want to feel more rested, more refreshed, more glowing? And I think that's a healthier way, that's a healthier aspiration, because it doesn't just rely on one thing. It's about trying to get more sleep, thinking about how you're eating, thinking about exercise, thinking about stresses, going outside for a walk, doing something that drives passion and pleasure, as well as thinking of your skincare routine, your sunscreen, and doing selected treatments that make sense for you, whether that's a chemical peel, a laser resurfacing, getting rid of pigmentation, getting rid of redness, reducing fine lines, sculpting the abdomen, or treating your pelvic floor.
Now we're going to go into our quick fire round. We're calling it the 2 a.m. Google list. So these are the questions many women end up Googling in the middle of the night, and they really shouldn't have to. So are you ready?
Yep. I'm ready.
Right, question 1. What's the top priority for a woman if they're pregnant or postpartum and wanting to look after their skin?
Use hyaluronic acid and sunscreen.
Number 2, is it safe to use retinol while breastfeeding?
Yes, but be careful with your baby.
Thank you. What's the best thing to help with pigmentation after pregnancy?
There's a whole group of products called tyrosinase inhibitors. You're going to look out for 3. I mentioned just 3. Arbutin, azelaic acid, cysteamine. Don't forget your sunscreen.
And finally, what's your number 1 tip to someone suffering with changes in their skin after having a baby?
You're feeling is normal. You've had so much that you've done. You're a hero. And anything that you think has been shifted during pregnancy, it can be shifted back to a place that makes sense for you.
So before we finish each week, we ask our listeners to submit their questions so they can have advice directly from the expert. And this week, a message has been sent in from one of our A Long Way to Go followers, Sophie. So here's what she has to say.
Hi, my name's Sophie, and my question is, where do I start with new skincare after having a baby? I literally feel like I've aged 10 years overnight.
Hi, Sophie. What she's just said there, I hear so many women say. And we used to think that aging was linear. Now we know it kind of does these steps. And so if you feel like your skin has suddenly changed, usually it's because of hydration. Sudden changes, if you think of the driest day that you've had, every line looks like a crevice.
Yes.
And when you hydrate, things suddenly seem much better. So I'm going to assume she has more dry skin. So Sophie, you're going to start a gentle cleanser or even a milk-based cleanser. You're going to start hyaluronic acid and you're going to lather that all over your face. You're going to go with a thick, rich moisturizer and then a sunscreen. And then at nighttime, you're going to start rotating in a gentle retinoid to help thicken up the lower part of the skin. That's the dermis. And you're going to use that like 3 times a week, like a Monday, a Wednesday, and then a Friday. And if you want to do something to kind of boost your skin, you could think about having skin boosters. Now, skin boosters can be things like Profilo or polynucleotides to boost the skin, or it could just be a good face mask at home.
Amazing. And just finally, what is one thing every woman should know about their skin during and after pregnancy?
Skin is dynamic and it will change. It'll change in ways that surprise you, and that can be positive, and sometimes it can be negative. But the great thing about skin is that it bounces back. So a lot of women are really scared about changes that they see in their skin during pregnancy. I think it's going to last forever. It doesn't. It will change. And anything that's there that you think, oh gosh, I wish that wasn't there anymore, there are things that you can do if it bothers you.
You have been listening to A Long Way to Go with me, your host, Katie O'Malley. If this episode resonated, please share it with someone who might need to hear it. And if you have a question or story you'd like featured in a future episode, you can get in touch through our socials at A Long Way to Go Club. Wherever you are in your pregnancy or postpartum journey, there might be a long way to go, but we're here with you every step of the way. See you next time.